my ablation didn't work and my AFib is back. What can I do now? So, Andy, as you've done a lot of ablations, and I know that your success rate was better than most. But
better than the best in the world. Yeah.
The AFib is back. So this is going to be a lot of people, obviously. We know that, depending on what you're looking at, someone like me who's a total critic will say 50% of the time we fail at after a year. In any case,
I don't even think that's a total critic. That's about what I would quote even, someone who did a lot of AFib ablation and thought he was pretty good at it. Certainly if you're paroxysmal AFib, Jack, paroxysmal AFib is AFib that comes and goes on its own, lasts less than 7 days. There's a higher success rate. But if you're persistent AFib, that it lasts 24/7 for a week or more, or permanent AFib, that even if you shock the person, they're still stuck in AFib, those patients have a very low success rate in ablation. But regardless, anybody that has an AFib ablation, even if it works initially, the same underlying processes that cause the AFib in the first place are still in play. And I didn't recognize that when I was just conventional medicine. But that's what we can do in natural heart. Whether you have a cath and a stent or have an AFib ablation or any other kind of ablation for arrhythmia, whatever processes cause that inflammation, cause that oxidative stress, whatever nutrient deficiencies or leaky gut or whatnot, those same processes are going to cause a recurrence, be it in 1 year, Jack, in 2 years, in 5 years. So we can help all these people tackle the root cause. That's one thing. Now, what can this patient do that had AFib ablation and it didn't work? Well, there's 3 options basically. One is another ablation. 2 is anti-rhythm medicine, which have some risks. They're kind of poison to some extent. Another way is rate control medicine, and then the last way is trying naturally with us, trying to find the root causes and fix those with supplements, biohacking strategies, diet, etc.
Yeah, I like to tell people that we're not anti-ablation at Natural Heart Doctor. We're just more of let's, as quickly as possible, try and work on the root cause of why they have a heart rhythm problem. Let's address those things as quickly as possible. And then if we are maybe not successful in that, we can go for an ablation. But what we've done is that we've optimized the person for the next ablation. And I think that the literature is very clear. If you have lower inflammation, lower oxidative stress, better numbers, if you're a better candidate going into the ablation, then we're much more likely to get better success in the short term, the long term, with less side effects from the procedure, right? The procedure carries risk, and there's radiation exposure.
Absolutely. Yeah. The 3 things I think you really have to optimize, Jack, are hypertension should be well controlled. Sleep apnea is another thing. If you have untreated sleep apnea or even treated sleep apnea, your success rate is going to be way lower. And then any fluid imbalance like heart failure or high filling pressures in the heart. If we optimize heart function, optimize sleep and sleep apnea, and optimize hypertension, you're going to do much better and have much lower chance of recurring in the AFib. Or control the glucose too. Diabetes causes a stiff ventricle, and we can control the diabetes. That's going to help a lot too.
I think, in short, everything that we do at Natural Heart Doctor, from our methodology of the eat well, the live well, the think well, that's going to help. Then we do the most in-depth testing in the world. And then if we need to, we can delve into some evidence-based supplements, the biohacking strategies.